Live streaming is on. So, good evening, namaskar, everyone. I'm pleased to share with all that today we have cardiologist Dr. Kapil Chhatri with us. Sir is DM cardiologist and currently Associate Director, Department of Cardiology at Max Hospital, Mohali. Sir, we welcome you on behalf of Indian Association of Preventive and Social Medicine and Foundation for People-centric Health Systems.
Thank you so
This
much.
is a series of public webinars. We are doing it for public awareness. And we welcome you, sir.
Wonderful. Thank you so much for inviting me and looking forward to a very healthy interaction.
So, sir, shall we start with the discussion?
Yes, sure.
Sir, these are the questions usually they are there in mind of common people, common man wants to know, like lipid disorders. Being a developing country, we are moving from underdeveloped to a developed nation, and during that course, our population in India is getting exposed to very unhealthy habits as well, or we can say the Western food, and as a result of that, we are facing this issue of lipid disorders, which was not heard of in maybe our previous generation. So, sir, I just want you to throw light on what is this lipid disorder? This is some single disease or a group of diseases, or what is it?
It's a very nice question. Like you said, India, especially last few years, we are little more aware about lipid profile and lipid disorders. And as people are getting educated, I think they are getting their tests done. More labs are opening up, a lot of preventive health checks. Now, what these lipid disorders comprise of is basically, there are different components of lipid profile, like we say, and say LDL cholesterol, total cholesterol, or triglycerides. These are the bad cholesterols or the bad ones, which will, if on the higher side, cause damage. And then you have a lower levels of good cholesterol, that is the HDL cholesterol. So imbalance between these basically leads to dyslipidemia, and the levels beyond a normal range, or these days we use range, otherwise there is the correct term is percentile. So above those levels, which may lead to certain diseases.
सर ऐसे कौन से डिसीजेस है, लिस्ट है जो लिपिड्स के कारण हो सकते हैं, और उसमें सिर्फ कोलेस्ट्रॉल ही इम्पोर्टेंट है?
No, like I said, cholesterol, let's first see, is important for the body. Cholesterol in normal people, in everybody, is produced by the liver and released in the bloodstream. Now, it may be required for cell membrane maintenance, hormonal production, vitamin D metabolism, food digestion also. So these are the beneficial effects, and cholesterol is required. Now, if we take cholesterol in food, which is over and above what the body is producing, then there is more cholesterol and other components in the blood, which will eventually go and clog the arteries, and then they cause damage. Now, dyslipidemia or deranged lipids may be starting point of certain diseases, or they may be secondary to present conditions. Now, say somebody has a deranged lipid profile, the risk of developing heart disease, stroke, peripheral vascular disease is high. Now, somebody is having diabetes, hypothyroidism, autoimmune disease, kidney disease, especially nephrotic syndrome, they will have lipid profile deranged later, secondary to the disease. So there are two components in this.
Okay, thank you for this throwing light on this, sir. सर जैसे कहते हैं कि गुड कोलेस्ट्रॉल, बैड कोलेस्ट्रॉल, तो इन दोनों में फर्क कैसे पता चलता है? क्या ब्लड टेस्ट से?
The body has a natural balance of, you have total cholesterol, then we have LDL cholesterol, triglycerides, and HDL. Now, LDL cholesterol in simple language is considered as the bad cholesterol, and the HDL cholesterol, that is the scavenger, जो LDL cholesterol और other harmful cholesterol को eat up करता है, clean up करता है, that is the HDL cholesterol. So it is the good cholesterol. Now, the balance of having good cholesterol high and others on a normal range is more required rather than this being low and others being high, which is a worse combination.
Okay, so we maintaining the proportion is
Exactly.
important. Okay.
So
Sir,
at the end of the reports, if you see, certain ratios are given.
यस सर, इसके लिए जो ब्लड टेस्ट होता है वो कौन सा है? क्या वो फास्टिंग में करना चाहिए या खाने के बाद करना चाहिए, और कितने फ्रीक्वेंसी से करना चाहिए लोगों को उनके बढ़ते उम्र के हिसाब से?
See, जो blood test commonly used now is a fasting lipid profile where a person should be fasting at least for 12 hours and preferably at least 2 to 3 days before the sampling. You should not have eaten outside food and things like that on a normal diet where we can assess properly in everyday life. The screening tests worldwide are recommended above 20 years of age, starting point.
Okay.
Now, unless there is certain risk factors, like I said, autoimmune disease, kidney problems in a lesser age group, above 20 years, one screening test 4 to 6 years of age gap. So once we have a baseline, this thing, and a person is moving up in age, knowing the risk factors, his dietary habits, exercising, you can always compare. At the same time, keep an eye, because it will not just, the lipid don't get deranged today and tomorrow it will cause disease. It is a, ongoing process. So 20 years of age, starting point, 4 to 6 years of gap, very high risk factors like smoking, alcohol, drug abuse, obesity, diabetes, 30, 35 years every year.
Every year.
If we go statistically, in more worldwide, above 30, 35, 42 and above % population have deranged lipids. So in this, we have to identify who to treat and who not to treat and how to keep an eye.
Exactly. So then what is the stage where we have to really start them on medication, or there is some period that the patient gets after diagnosis where he can control it with other activities, non-medicated things?
See, it's in a person where there are no risk factors or very few risk factors or risk factors which are easily manageable. There you can go for lifestyle modification first, try it out, keep an eye, keep repeating the lipid profiles and see how he is doing by taking all those steps. If it doesn't show a downward trend, then we treat. Otherwise, you have to first is identify, along with the, let's say somebody has a deranged lipid report. What is the age? What are the risk factors? What is the likelihood of other diseases happening? Is it primary prevention or secondary prevention? And is this person going to fall in the group which will follow the lifestyle modification, including exercise, diet, quitting alcohol, smoking, food modification, all those things? So you start treating them. Now in India, the problem is keeping a follow-up of all these patients. Somebody might come to you for a few months, then go to somebody else. There's a lot of advice on the Facebook, Google, all those social media apps. So these people, sometimes it is better if there are a lot of risk factors to start treating, slowly get them into the mold, then take the drugs off and then see how they are doing.
Okay.
Some of
so
them.
It's not like once the drugs are started, then it's forever.
No, it is not. It
is
not
on the
at all.
lifestyle. The patient can do it without medication.
Yes. The primary goal is to bring the lipids down with the balance of medicine and lifestyle modification. If it's both work, then you take the medicine off if there are lesser risk factors and it is primary prevention, and then see how they are doing time to time. Some may not require at all. Some may require after few years or few months. It depends on person to person.
तो ऐसी कोई यूनिफॉर्म स्ट्रेटेजी नहीं है ना कि आफ्टर एज ऑफ 40 सबको हमने लिपिड लोअरिंग एजेंट बाय डिफॉल्ट स्टार्ट करना है? बट इट्स पर्सन टू पर्सन.
It doesn't help.
Yeah, okay.
Because the choice of medicine is also different in depending on the situation. It is not only one drug. There are multiple drugs. At the same time, not only the lipids, you have to treat the other diseases, hypertension, diabetes, thyroid, cardiac problems, stroke, renal. So it's just mixture of both, getting the balance.
Okay. तो सर जैसे हम कहते हैं कि बैड कोलेस्ट्रॉल जो है वो फैटी, फ्राइड, हाई सैचुरेटेड फैटी एसिड, इन चीजों से बढ़ता है, तो क्या ऐसे भी कोई फूड आइटम है जिससे गुड कोलेस्ट्रॉल बढ़ता है या एचडीएल
Yes.
कोलेस्ट्रॉल बढ़ता है?
Yes. See, the thing is like over the years, the consumption of natural food products has gone down, and we are eating lot of junk food, processed food, and lot of fried stuff and things like that. The other thing is that for a man to survive and for good health, say you only require this portion of food, but we eat this portion, so this all is a waste. This is adding on to all the problem. What is required, we are eating more for the taste. What happens in our country, till you are about to throw up or you can't breathe, you don't stop eating. Very few people will have a limited amount of food which is
Portion
required.
size is
Yeah,
important.
so that is important. The other thing is that if we do away or minimize the use of processed food, fried food, using the wrong oils, and if we increase the consumption of fruits, grains, nuts, exercise, eating less of red meat and more towards fish, which is without the skin, that contains fat, and decreasing the fat content of the milk, low fat content or toned milk,
Skim
then
milk.
yeah, and combined with exercise, weight loss, quitting smoking and alcohol, so it will not only increase the good cholesterol, it will bring down the bad one also. Some people, the bringing up the good cholesterol might not be easy, but bringing down the bad ones is relatively easier.
तो गुड कोलेस्ट्रॉल बढ़ने के लिए मीन्स कंसिस्टेंसी चाहिए है इन
Very much,
चीजों के लिए।
very much.
ओके। और सर यूजुअली जैसे आप कार्डियोलॉजिस्ट है तो लोग एक कार्डियोलॉजिस्ट से ये जानना चाहते हैं कि हम कुकिंग के लिए मीडियम कौन सा यूज करें, क्योंकि इंडिया में जो भी खाना है वो फैट के बगैर तो बनता ही नहीं है, तड़का तो लगता ही है। तो वो यही जानना चाहते हैं कि हम कौन सा ऑयल यूज करें। कुछ लोग कहते हैं हम सिर्फ घी में खाना खाते हैं तो वो ज्यादा हेल्दी है, कुछ लोग सिर्फ सरसों में खाना खाते हैं, नॉर्थ में ट्रेंड है सरसों का ज्यादा, तो वो ज्यादा हेल्दी है। तो व्हाट डू यू रिकमेंड फॉर देम?
It is not a personal, my choice. It is what the books say, or, we still don't know the magic oil. But olive oil is perhaps the best. Minimizing the oils which have trans fats. And the oils like, olive oil, canola oil, sunflower oil, these are good, supposedly. But anything which is deep fried, where we say we make it deep red, where we increase the trans fats, that is the problem. If we just minimize it to the minimal use which is required, then it should be all right. Ghee, I am not too sure, because most of this data comes from the Western world and they don't use ghee at all. But it's not recommended. And butter also, the ones we are using.
Yeah. और सर जैसे अभी बच्चों में भी फ्राइड स्टफ, पिज्जा, ये चीजें बच्चों में भी बढ़ रही है क्या, तो क्या उनमें भी लिपिड ऑर्डर्स देखे जा रहे हैं, डिसऑर्डर्स?
Yes, they are very common, and we are to be blamed as parents and elders partially, because we personally feel till somebody is an adult or 18, 20, 30s, nothing will happen. This is I said, very small ongoing process. The fatty streaks start getting deposited in the arteries in the childhood only.
Okay.
They will slowly increase. Now, whether it will go on to cause disease or not depends on person to person and how their lifestyle is later on in life. But it will start in childhood. Now, you will be very surprised. Let's say a pack of fries, French fries from McDonald's, is above 500 calories. You need to exercise so much to burn that. Now, if the kids can balance it, plus, out of love, we think putting a lot of ghee, oil, butter is healthy. It will help them. No. It starts in the childhood, plus these habits go on for the life.
Yes.
So once we change our kitchen habits, probably a lot of things will change.
So usually इंडिया में ये कल्चर है ना, एल्डर्स ये कहते हैं कि कोई बात नहीं, अभी बच्चा है, इसको खिला दो, अभी तुम यंग हो, तुम्हारा तो डाइजेस्ट हो जाएगा, तुम खा लो। तो यूजुअली 40 तक तो, जब तक तो बिल्कुल ओवरवेट नहीं होना शुरू हो जाता, तब तक उसको खिलाना ही खिलाना है, उसने खाना है, ये कॉन्सेप्ट
Yes,
है।
childhood obesity, the early adolescent diabetes is becoming very common. Their playing time has decreased where they burn all these harmful things. They are sitting on the gadgets, the school hours are more, the traveling time is more, TV time is more, all the iPads and everything. It is very important to start paying stress to the children and what they are eating equally as compared to anybody else. It should be a priority.
Right. Means the recommendations for adults, they go for kids as well, same recommendations. Sir, for adults, how much should be the exercise time in a week? Or
See, the ideal exercise time minimal is about 30 minutes a day for 5 days a week. Ideally, it may be any form of exercise. Now, the definition of healthy exercise is also variable. You have to have a mixture of, it's not only weight exercise, or some people only do running, some might do swimming. You have to find the right balance of isotonic, isometric, and anaerobic exercise.
कि
But
अभी तो
minimal,
जैसे
any form of activity.
जिम का ट्रेंड बहुत हो गया है यंगस्टर्स में, तो are those exercises going to help them to keep their lipids in balance or to improve the HDL cholesterol?
See, it's maybe a good thing so that at least they're getting off the chair, going somewhere to do something useful, not eating at that time. But the thing is, the supplements, some people start taking unsupervised early, not finding the right balance. Everybody wants to go to the gym to have a good body
Yeah.
for photograph, to put up on their Instagram or things like that. The weight training alone, starting at the wrong point of age, is again wrong. So the gym is good provided it is balanced for younger age group compared to the others.
सर, ये तो आपने कोलेस्ट्रॉल के बारे में जानकारी दी, फूड्स के बारे में, एक्सरसाइज के बारे में। अब हम मीन्स लास्ट वर्ड ऑफ कॉशन फॉर पीपल और योर एडवाइस बिफोर वी एंड दिस सेशन कि फॉर प्रिवेंशन ऑफ द हाइपरलिपिडेमिया और लिपिड डिसऑर्डर्स, the strategies for prevention.
See, like they say, prevention is better than cure. And it's all every time, people I have seen, they get a deranged report, they get depressed. It is not that difficult. We have to start, like I said, food, less of trans fats, less of chocolates, less of processed food, less of red meat, less of chips, chocolate, juices, all those things. Increase the food, fruit, vegetables, their portion should increase, grains and all those things. Managing diabetes and hypertension, they become very important because they go hand in hand with the dyslipidemia most of the time. Checking your weight, obesity, again, now we have a new term called metabolic syndrome, insulin resistance. All those things need to be taken care of. Alcohol and smoking needs to be stopped. Exercise has to be promoted. Like they say, it's not only gym. If you can't do anything, at least walk briskly for half an hour a day. Less of stress. Stress not directly influences lipid, but people start taking alcohol, they might smoke more, they might eat more, they will sit, think, eat. So that stress again is linked to this. So that is why they say meditation, yoga, all those things. We know all the answers. It is just getting it back again in the right place.
Yes, getting it into practice is the thing that we really need to do.
It's been there, it is in front of us. We just need to spend some time identifying where we are going wrong and what all I need to do and how to keep it maintained and progress.
Sir, what is your recommendation for preventive health checkup? After a certain age, what should be the duration and what should be the different tests which should be carried out as a preventive health checkup? Do they need to visit hospital even if they are asymptomatic?
See, there are a lot of factors. Now, family history plays a role. If there is a lot of family history of, let's say, coronary artery disease, stroke, kidney disease, peripheral vascular disease, somebody not having risk factors also needs to have regular screening, because genetically, passing on is one of the biggest risk factors. So catching things on time. Number two, a person, what is his lifestyle? What are the risk factors? So as we say now, it is being recommended for people around 30, 35 that they should go for different screenings. Then have a pattern, whether it has to be yearly, 2 yearly, how are the symptoms, how is the body weight, keeping all those things, whether when do you start having TMT, echo, when do you want to see for diabetes, if at all somebody. So those things have to be mixed with this.
Okay, fine, sir. And sir, anything additional from your side on these lipid disorders you want to advise to general public?
It's not only for general public, it's in fact for all of us. We take it very lightly. I think this is one of the starting points of lot of problems. We brush it under the table. We don't take it seriously. We say, oh, कल ये खाया था, परसों ये खाया था, मुझे कुछ नहीं हो सकता, मैं तो exercise करता हूँ, ऑफिस में चलता हूँ, all those things. No. Take it seriously, nip it in the bud. All of us, including doctors, lifestyle for us also is different, as a lot of high risk for this. Once we accept it, please have it treated, understand your disease, read about it, and it should be a long-term goal, not knee-jerk reaction, 2 months we'll stop this and then 3 months we will party. No. So it's a long process where half of the problems can be taken care of, and it is highly under evaluated, looked after problem. Lots and lots of people are roaming with deranged lipids for a long period of time, never looked at it seriously.
सर थैंक यू सो मच कि आपने बताया एक्चुअली कि पता भी होता है लोगों को, पर उसको करना, उसको सस्टेन करना, उसको समझना, दिमाग में रखना कि ये हमने करना है और उसको हमेशा के लिए सस्टेन करना, इट इज वेरी इंपॉर्टेंट. कीप अवर लिपिड्स एज अवर मे बी previous generation used to have more of healthy lipids or healthy cholesterol they used to have. And so thank you so much for joining us and sparing your valuable time from your
pleasure, and thank you. It was very nice, and all the best for your future programs also. Thank you.
Thank you so much, sir.
Pleasure.